Hello, I'm Monica. I'm one of the lecturers here at Monash Nursing and Midwifery. Taking vital signs is a very important role of a nurse and midwife. Vital signs involves taking a patient's blood pressure, pulse, respiratory rate, temperature, saturated oxygen levels, and also their conscious state. Today, I'm going to be taking you through how we take vital signs. We're going to do a set of vital signs on this patient with Kate and Caroline. So the first vital sign we're going to be doing, Kate, is blood pressure. We always start with the patient's blood pressure because it's the most lengthy task that we have to do, and we want to make sure that we get it accurately. So we've got the cuff on the patient's arm. I'm going to place the stethoscope on the patient's brachial artery, and then you're going to pump up the sphygmo, and you're going to slowly release the valve and listen for the patient's systolic and diastolic values. Taking a patient's blood pressure is a very important vital sign that all nurses and midwives need to be aware of. Right, shall we do the pulse next? So Caroline, if you could do that for us, and you're going to place your fingers on the patient's radial pulse, and you're going to gently feel that pulse for a whole minute. There are many sites that we can take a patient's pulse, but the most common that we use in nurses and midwives is the radial pulse and the brachial pulse. If it was a little bit lower or a little bit higher, we would escalate that to our nurse in charge and let them know what was happening with the patient, and we keep a close eye on that depending on what it was. The next vital sign, Kate, that we're going to do is the patient's respiratory rate. So we would actually do it as part of the pulse. So we'll be taking a patient's pulse for a minute, and then we would actually be taking the respiratory rate for the next minute. The vital sign that tells us how someone is breathing is through their respiratory rate. We don't want to tell our patient that we're actually taking their respiratory rate because they might breathe a bit slower or faster because they're conscious of what they're actually doing. The next vital sign that we're going to do, Caroline, is the patient's temperature. So we're going to get a tympanic thermometer. I'm going to place it in the patient's ear. So you're going to pop that in, put the probe cover on, and put it in quite firmly because we want to make sure we get a really accurate temperature. A patient's average body temperature is 37 degrees Celsius. If it's slightly elevated, it might be that they're just a little bit warm. If it's very elevated, it might mean that they have an infection or something is wrong, and that's why they're here in hospital today. The next vital sign, Kate, that we're going to do is measure the patient's saturated oxygen levels. So we're going to actually prop that little machine on the patient's finger, and then there's a little button that you press, and that'll give us an accurate reading of what their saturated oxygen levels are. Saturated oxygen levels will measure the amount of circulating blood that the patient has at that time. Normal is between, say, normal 98 and 100%. Might be slightly lower. Sometimes if patients' fingers are cold or if they've got nail varnish on it, won't give you an accurate reading. If that happens, I usually just warm up their fingers, but usually we'll get an accurate reading pretty quickly. The last vital sign, Caroline, that we're going to do is measure the patient's conscious state. So I'll do a demonstration now on how we would do that. So we'll go up and say, "Hello Henry, I'm Monica, I'm your nurse for today. How are you feeling? Do you know where you are today? Do you know what day of the week it is?" So we would measure a patient's conscious state as every time we meet a patient. So whether that be when we walk into the room, when we get handover of a patient, or when we're doing vital signs. So we would need to make sure that they're alert and orientated. If they weren't, we would have to somehow get a response from them and accordingly document what we find from those responses. Thanks for joining us today. We hope that you've learned something new. We look forward to seeing you here on campus at Monash Nursing and Midwifery.